As part of your first visit, we'll be taking some x-rays to see what's going on in your neck and your low back. When we look at the x-rays, there's a few important points we want to cover. Number one, and perhaps in my opinion one of the most important, is the curve of your neck and your low back. You could simply call it posture. When we look at the neck, we're going to see a nice C-shaped curve. We'll demonstrate this with this ball. The head weighs about 10 pounds. We're going to pretend that's this ball, and the neck is supporting the head. When you hold this weight just like this, you'll find that it's very easy to support it. You can do this at home with a 5-pound weight or a heavy can. As you shift the weight forward, you'll notice that it becomes much more difficult to hold and much more stressful on the neck. This is what's causing the neck pain, the shoulder tension, and in many cases the headaches, as those muscles and nerves are under greater stress. So when we look at the x-rays, we want to visualize the position of the head and the position of the curve. Let's go ahead and look at an x-ray now. Let's see what one looks like. Now in this patient, you're going to notice that there's no curve. The neck is virtually straight. As the neck becomes straighter, there's more tension and stress on the shoulders, the neck muscles, the ligaments, the joints, therefore the discs. Over time, this can manifest as disc degeneration, calcium deposits, bone spurs, bulging discs, and lots of other problems. So when we look at your x-rays, this is what we're going to be looking for, the curve of your neck. Here we are at our traction station. We're going to do a demonstration of the traction. As the patient walks up to the traction, she'll find that the pad is just below chin height. She's going to place the curved piece behind her neck. She's going to look up towards the ceiling, and she's going to place the other pad underneath her chin. She'll then grip the bars with her palms facing her, and as she slowly bends her knees and drops down, she's going to breathe in, and as she comes up, she's going to exhale. Now you'll notice as she does this, she's looking up. Looking up will place the neck in a normal curved position, which is what we want to do with correcting posture. The traction is opening up the disc space. It's stretching the ligaments and the muscles that have been injured from poor posture, such as sitting in front of a computer all day, accidents, injuries, things of that nature. The patient will do the traction 10 to 20 times and then work up to 60 repetitions. This traction can also be done at home as part of a rehabilitation program in helping get rid of neck pain, shoulder tension, and headaches. It's done twice a day, once in the morning and once at night. It allows the patient to be in charge of getting rid of their own neck problem. Next, we're moving on to the link trainer. We're going to be doing some additional neck treatment for this patient here. She's going to place the curved piece of the bar behind her neck. She's going to be gripping these bars here. Next, she's going to arch her low back, and she's going to extend her neck over the curved piece. What we're doing here is strengthening the neck muscles and the posture. Now, many times patients have been to chiropractors, they get adjusted and they feel okay, but they feel like they have to keep coming back. That may be because the muscles and ligaments in the neck and the upper back were not strengthened to hold the adjustment long term. This is very important to correct posture, especially for people who are sitting at a computer all day, working in a head forward position. As you strengthen this posture, the results of your adjustment and of your spinal correction will last much longer. She's pushing her head back against the bar, and she's strengthening the front and the back of her neck. Very specific type of a rehab program. This works very well for neck pain, shoulder tension, and headaches.